Hey team, it's Dr. George here, and Thorn Harbour Health had a really great community forum just last night with the amazing Vincent Cornelisi, one of Australia's most well-regarded researchers and experts when it comes to sexual health. Now, there was a lot of information, and I've taken over 2 pages of notes, and for those who were not able to attend, I would love to be able to share with you a synopsis of the event last night. The monkeypox virus can be found in bodily fluids when a person is unwell. So that's the saliva, vaginal secretions, pre-cum, and semen. With semen, there is a particular caveat, and that it can be found in semen up to 12 weeks after the person has completely healed of all of the lesions on the skin. And this is a genetic design, and it's because the testicles are sort of isolated from the immune system, which means it would take longer for them to heal. For a person to become infected with monkeypox, the virus needs to get onto a mucous membrane, or it needs to be able to get in through broken skin. So this is the main reason that we're seeing pretty much sexual transmission across the world. People, when they become infected, they're getting their little pustules and their little sores on inside the mouth, on the genitals, in the arse, in the vagina, or around those areas. And that's partially because of skin-to-skin contact in that area, but it's also most likely through the intimate bodily fluids. Initially, it was concerned like, can the virus stay on bedding and towels? Now, interestingly, the virus is actually quite fragile, so it can easily be killed with soap and water as well as UV light. So if you have discovered that your bed partner has monkeypox, they could sleep in a separate bed, and you just need to give all of the sheets and bedding and towels a good hot wash in soapy water and pop them out in the sun for a little bit of sunlight to dry, and they will be fine and sterile. Vincent said, look, that the risk of transmission from the bed sheets is probably way, way less than the risk of the sex that you're going to have on the bed sheets. The incubation period can be short as 3 days, but can be as long as 21 days, perhaps even longer. Initially, some people might get fevers, cold-like illness, temperatures up to about 38, big lymph nodes, and just feeling awful. Also, you might get a rash on the head, hands, and feet. After that, people tend to develop the blisters, sores, and pustules that you're seeing. And currently, as I said, we're seeing them around the genitals, inside the mouth, inside the rectum as well. Inside the rectum, they can be very, very painful, and in the mouth they can be painful. I've anecdotally heard of a patient who had the lesions inside their urethra, which made going to the toilet extremely excruciating. So ways that we can avoid transmission is avoiding skin-to-skin contact with a person who is actively infectious. In particular, you want to avoid the lesions getting in contact with your mucous membrane, so inside the mouth, inside the anus, inside the vagina. Now, the use of condoms may not necessarily stop you from getting infected, but the important thing is that they may stop you from getting an infection inside the arse. Or, and this is my add-on to Vincent's conversation, is that it may stop it from getting inside the urethra. These are the 2 sites that are particularly painful. So use of condoms may modulate the illness so you don't get it in the sites that are really, really awful to have them in. Please also consider having an idea of like a sex bubble. This is something we had during COVID, and it might be worth considering as well. The question was raised about, can persons have a monkeypox infection without any signs? And studies out of Europe have shown that somewhere between 1 to 5% of people who had presented to get STI screening, they also checked for monkeypox. And 1 to 5% of people had monkeypox virus inside their body, but did not have any symptoms. Massage therapists, physical therapists who are offering non-sexual acts, They are very unlikely to be at risk of monkeypox. One, because when they're massaging the person, they'll be able to see if there's any sores or viruses, and if they do, they can advise the person that they need to go and get medical help and probably discontinue the massage at that point. But also that the virus needs to get into broken skin. So the skin on our hands and our arms is generally intact and quite robust. So it would be difficult for the virus to get in through there. But remember that it could be something as simple as microtrauma, say a nick to a nail bed, or a minor bump or a scrape on your skin. Now, when it comes to the vaccine, there's some updates here as well. So what we know is that it is a good, safe vaccine. It's absolutely safe for people living with HIV. It is a live virus, but it has been treated in such a way that it's not able to replicate and it cannot give you the illness. But it really does create an excellent immune response. What we know is that around about 2 weeks after the first injection, 30% people will have developed enough antibodies to be considered protective, and 4 weeks after the first injection, around about 60% of people will have enough antibodies to be considered protective. People living with HIV, this takes a little bit longer, but when you've had the second shot, both groups meet together, that the HIV positive people and the HIV negative people seem to have a very similar rate of protective antibodies. The minimum time to get the second shot would be 28 days. You absolutely must wait 28 days, but longer is actually better. If you are considering to getting the vaccine when you're overseas, whilst this is a great option if you've been having difficulty, please be aware that it is considered a medical intervention, and be sure that your travel insurance would cover it, because that could be considered medical tourism, and that could lead to avoiding of your insurance. So check that before you consider getting your vaccine overseas. And on your return to Australia, make sure that your GP adds your vaccine to your immune register here in Australia. We can add vaccines that were given overseas, and I do this on a regular basis. If you're of the older generation that has had a previous smallpox vaccine, this is great news, because that will have created a memory within your body. And when you get your first shot of the vaccine, it will reactivate that memory and you'll get a really good antibody response. The current recommendation is you will only need 1 shot. You will not need the second, because you're going to have a good antibody response. If you have had monkeypox, the amount of virus that you will have been exposed to is way, way, way higher than the vaccine, which means that you're going to most likely have lifelong immunity to monkeypox. So this is interesting from a pandemic perspective, because unlike COVID, with monkeypox, once you've had it, that's it. You can't get it again. So this might make the whole pandemic a self-limiting experience, which is great, great news. The other thing that we can do is ensure that as many people get vaccinated as possible. And one way that we're going to ensure that is looking at different ways of administering the vaccine. So we're looking at giving the vaccine is a small bubble or a blister into the forearm that goes into the layers of the skin. What we know is that it takes much less vaccine to do that, and it produces the exact same immune response. So this means that we can actually vaccinate 5 times as many people with the extremely limited supply we have of the vaccine currently. So the other thing to note is that here in Victoria, we are seeing community transmission. It used to be like if a person had traveled to America or if a person had traveled to Europe, that they bring it back to Australia and then could pass it on to their friends. But what we're now seeing is community transmission. So people who are sexually active are passing it between each other. So for this reason, we do recommend, 1, get the vaccine when you can, and 2, consider holding a diary. Remember that the incubation period is between 3 to 21 days. So you need to be able to at least reference your past sexual contacts for the past month, So you can let them know if you get monkeypox. Please let the people know that you've had intimate contact with over the past month so they can go and get tested and make sure that they're not having a episode as well. So there we go. That's a roundup of the fantastic event by Thorn Harbour Health and Dr. Vincent. Highly recommend if you can get involved in these events. They are really, really good, and it's your opportunity to be able to ask questions to community experts. Have a great day, and I hope you found this helpful.